Awesome.
So,
Hi, everybody.
welcome everyone. I'm just going to do quick housekeeping before you start.
Go
That's
for
right.
it.
So we're recording today's call. I'll just welcome everyone to this month's Policy Learning Collaborative call from Open. We're a relatively small group today, but we'll still ask that folks keep themselves on mute to avoid any background noise, but take yourself off mute early and often, and feel free to use the chat. And I'll turn it over to Sarah Holland, who looks like she's got something to say.
I just have all the things to say. Now, I'll be facilitating us today. Annalise is going to take some notes, but we'll tag team. Tanya has a conflict, so she's going to be missing us. We're so small. Does everybody want to just do a quick hello? Say who you're with. I'm Sarah Holland with Virginia Health Catalyst in the fine Commonwealth of Virginia. I co-lead this really fine group with Annalise and Tanya. Annalise, do you want to say hey?
Hey everyone, I'm Annalise from AIDPH. I'm glad you're here sharing your Friday with us. We can just popcorn. Whoever wants to pop in can do it.
Hi everyone, Bailey Revis at Families USA. I was unmuted, so figured I'd go next.
Hi everybody, Deb Jacoby from Minnesota. I'm Policy Director at Apple Tree Dental.
Hey everyone, Bianca Rogers. I work with CareQuest. Happy Friday.
Happy Friday.
Hey everybody, Pierce, also with CareQuest.
Christina, also with CareQuest.
Yeah, Ellen and Tracy.
Hi, I'm Tracy Anselmo. I'm with Delta Dental of Colorado Foundation. I'm their policy manager.
Hi, I'm Ellen. I'm the Executive Director of the Michigan Oral Health Coalition.
Awesome. Well, welcome everybody. So we've got a pretty jam-packed agenda today, but one of the things that we did want to take some time to chat about is follow-up from our Hill Day conversations that we've been having kind of sprinkled throughout these meetings for the past couple of months. So just to ground everybody kind of back into, historically, we have done a Hill Day with a policy summit that has been at times virtual. And then I think most everyone remembers the really large one that we had in conjunction with a national meeting before the pandemic. And lots of conversation about the effectiveness of a Hill Day, about how well it fits in with Open's agenda of being able to set a legislative agenda to be able to lift up policy issues related to oral health for all people, and also to highlight some specific policy initiatives. In the past, we've talked a lot about funding for states through CDC and other initiatives, and I think have found it to be pretty successful. It's no secret to this group that it is also a lot of work, and that typically it has fallen on a national partner that was a grantee to organize much of the messaging and the talking points, and to keep some consistency among all of the partners across the nation, and then also to help set the agenda for the policy summit, which over the last couple of years has been virtual and included lots of breakout sessions. So again, presentations need to be coordinated and things like that. I think that network members have found it to be really, really valuable. And also it continues to be a lot of work for folks that are leaning in to make it happen. We have been, Annalise and Tanya and I have been chatting with IFE, chatting with particularly Families USA, who really leaned in and helped to plan a lot of the work in the past. And Tanya also reached out specifically to the ROCT leads. I should back up a little bit to remind everyone that in terms of the congressional appointments, we typically relied on state reps to coordinate all of the congressional appointments with their state. So lining up everybody's schedules, making sure that everyone in the state was comfortable with the talking points, and coordinating all of those appointments with either the congressperson themselves or with their aides. I think I see a lot of nodding. It's no small task. I think to somebody who hasn't tried to set up a lot of congressional appointments, that can seem like it's not a big deal. For people who have tried to coordinate multiple schedules with individuals on the ground as well as folks at the Hill, I think you understand what a significant time commitment that is. And also the potential for those meetings to be really effective in sharing our message and really showing a unified front. So knowing that the policy summit in and of itself is a lot of work in terms of coordinating agendas, definitely valuable to the network with positive feedback for those who have attended. Typically that's been coordinated, or that's been in conjunction with congressional visits that ideally are happening on the same day. I think at one point it was on the same week, that are coordinated by the state reps. So we wanted to understand what was possible in terms of infrastructure of somebody, of bringing that to the network again, understanding that right now we don't have an organization that has received a grant to put this on. So there's no entity that is being funded to make this happen, with the exception of any funds that Open itself might have. So in order to better understand kind of the commitment from the network, the ability of folks to really lean into this work, we chatted with folks at Families to understand what that commitment looked like. We chatted with Ife pretty considerably to get a sense of what her vision might be. She's definitely really, I don't want to put words in her mouth, but I think Annalise, you can kind of back me up on the conversation we had with her. She's really interested in doing a full policy summit again that would be virtual, as well as congressional visits all happening on one day in conjunction with that policy summit. And then also seeing us, this group, the policy NRT, to determine the messaging that we would be sharing forward with the congressional leaders and training folks in the network on during that policy summit. So in order to understand the feasibility of being able to do that, we've had a lot of conversations, and among them were, we had an opportunity to reach out to all of the leads in the region, as well as this to get some feedback from state reps about their kind of ability to do that. And so based on all of those many conversations, and based on understanding Ife's vision, and also based on understanding resources that may or may not be available to make this happen, we have 3 potential options for Hill Day. I can share my screen because they're on the agenda. Can you all see that?
It's cut off for me, Sarah. Oh, there you go.
Is that, how's
Yeah.
that?
I can see. Yes.
Give me a chance to read them. So essentially, right now, there is not any dedicated funding that is assigned to any kind of Hill Day or congressional, or to doing the congressional visits. But there is some discussion that there may be funding included in some grant money that Open may receive, and they're not going to know about that until January at the earliest. And so a lot of these recommendations are predicated on that, on learning that information. So in some ways, it's difficult to make a decision on these 3 potential options because we are missing information that we're not going to have for a while. But I am curious, giving these 3 options, if anybody has any thoughts.
Sarah, can you just explain for number 2, why does number 2 reduce? Oh, it reduced the AV cost because there's no summit. Is that
Yes.
that's why? Okay.
Is the concern on the 3rd, which seems feasible financially and infrastructure wise, is the concern that it won't be as impactful? I mean, obviously, yeah. Is it in your discussions, did you talk, Sarah, or anyone about like how to make that how to make that have a sense of cohesion as well as that sort of dispersed action. Because I do think a lot of people at the state level enjoy being given a way to engage, which, you know, and that one possible, I'm just blathering, but one possible advantage might be that it's a lower lift for different advocates around the states to get engaged. I don't know.
Yeah, I think the conversation, and Annalise, please feel free to weigh in around this one, was it's certainly because it's not dependent on funding, the simplest to pull off. It feels like something that this group could work collectively to determine what the advocacy asks are, obviously with the input from the network driving that. And we have experience collectively in sharing putting together talking points and sharing talking points. I think the limit in effectiveness is knowing that we're relying on folks to set up their own appointments and there's not going to be a central scheduling. I think it's also important to think about, some of the feedback we got from the leads is that not every state has a state rep right now. So there's states where there wouldn't, even if we did go the state rep route, there are states that wouldn't have that central coordination. And many of the state reps are state employees, so who can't take that on. So that would further limit the amount of states that had active coordination in option 2 and 3. And so I think I don't want to speak for anyone, and except for myself. I think it's pretty clear to me that in terms of our ability as a group to affect the outcome, in some ways, I think number 3, we have the most, because we're the ones that are setting the talking points and sharing the information. Going to be much more difficult to measure outcomes because we're not going to have a central tracking point for, how many appointments did you have? We're going to rely on people to share that information with us collectively. Not having the policy summit, of course, limits education opportunities and other opportunities for people to be, sharing knowledge and sharing energy and sharing all of those pieces. It's also incredibly expensive and time consuming to pull off. I'm not trying to equate expense with value. I think it's really valuable. Or I'm not trying to you know what I mean? I'm not saying it's not valuable. I'm just saying it is also expensive. And so something to consider.
And never one to shush when she ought to. Excuse me if this is way too far afield, but if we're having to rethink this year, are there other elements that we could rethink about it? Like when the talking points and the things are, have we ever done more of a campaign to be sure that somebody visits every one of the in-state offices of these people? Or, just like if we're going to have to do something different, maybe we should say, what opportunity does that open up to do something different? And then in terms of getting people to report back, I don't know, people are busy, but if that could be made easy to just go to this and plug in, or, you guys have more experience than I do of how woeful the response is, but, or fabulous, but.
Sarah, could one option be that we have, a first choice here that you all go to IFE and say, we'd like you to apply for funding for 1 or 2. And then if it doesn't come through, our fallback is 3. Or do you feel like we need to make that you all need to make that decision now, what you want to pursue?
Oh, I'll hop in here because I don't want Sarah to feel like she has to field some of or all of these questions. I guess I want to reiterate, these options are informed by discussions we've had with IFE a few times now. So my understanding, and Sarah, I think this is the case, that there is an intention to apply for funding, but in our opinion, and also based on what we're hearing back from the ROCT leads, which we've also reached out to get their feedback, the cost that IFE is sort of describing is having to do with the event. costs like AV and, things with like an event, the cost that we're describing has to do with capacity and paying people to do the coordination. And so having to understand those two costs together, I think that's kind of in the place where we're figuring it out. And so based on the feedback that we've heard, where we're saying the cost of paying for people to absorb the work, that can't be ignored or dismissed. And so if we don't have the cost to cover capacity, we're suggesting an option that is feasible based on the capacity if we don't have the funding for it. So I do think, I just wanted to be clear, these conversations, we've definitely had them with IFE. We've described these options to IFE. And at the end of the day, we wanted to bring this back to the policy NRT with the hope of this group weighing in on what they also felt like was feasible with their own capacity too. Because the NRT is not going to, and the leads of the NRT are not going to develop a Hill Day as part of our role here. It's too much work. So while this group, I hope, would inform the efforts of an action day or a full Hill Day, if that is, if we have the capacity to do that, I think we just wanted to set expectations now and also kind of get a vibe for what this could look like. I appreciate, Deb, you raising the fact that an action day could look a few different ways, and that's something that this group could weigh in on too. If we feel like it's really important that we have an action day that is feasible and achievable and meets these kinds of activities, I think that's a great conversation to have. Did I say anything out of turn, Sarah? Is that how you...
I think, and I also want to add, I think that this feels very sensitive and a little fraught to me. And I think that Annalise feels the same way, and probably Tanya as well, because we're talking about funding that isn't ours, in our control. And we're talking about policy relationships that are really important to us. And I think that our ability as a network to achieve policy change is one of the biggest successes of Open, and to elevate oral health issues to Congress is something that I think we can do well. Candidly, it's difficult for me to see a scenario, because there's not an entity that would be, I mean, in the past, Families USA had a grant, and as part of their grant, they put on Hill Day, and there was a staff person who did it. It's difficult for me to see how we maintain our commitment to excellence and doing things excellently. And it is difficult to me to see how we maintain that with option number 1 or 2. And so I don't feel comfortable not doing things well. And I don't feel comfortable asking state reps to do something that is not in the job description that they were given or signed up for. And so I think that's where we have to be, where it's a really delicate balance, because Hill Day is really important. And our interactions with congressional offices is really important, and our ability to spread this message is really important. And I think, again, not speaking for Tanya and Elise, but the conversations that we were having with folks were filled with stress and anxiety about figuring out how to pull this off. And I don't have time to do this. And this feels like a burden that you are placing on me that I cannot fill. And so I think that we need to consider that as kind of the entity that is at least considered in charge of this. We need to think of all of those pieces as we're making recommendations, understanding that our goal is never changing, to influence, to be the lead driver of policy related to oral health and to lift up all the voices of the open network. So that felt a little bit like a press conference.
Thank you to both of you for that explanation. Makes total sense to me. Understood.
So sorry, just to jump in, if the conversation has ended, you can stop me, but one quick comment to add. So as someone who helped and coordinated with families on putting some of these events on, I too want to caution us on option 3, because I think about these opposite, like if we were to say, hey, this week, whoever wants to self-schedule appointments with legislators, like we can easily say, like, this is how you do it. We could provide them a template email, but then people are going to, like, offices are going to get emails from various people that could be in the same state. So I think we need to be thinking about like those very real logistical details that,
That's
I
a
do
great
like,
point, Bianca.
yeah, like I do like that option. And I think in the past we've even talked about like town visits. So kind of what Deb was saying, where instead of and these can be virtual or in person. I guess this was more of like when we were always going, when people would traditionally go to DC to do federal visits, you could do visits when senators or House reps are at home, and those sometimes have, a different weight to them. And so you could do hometown visits. That's another option. I think in the virtual setting, I don't know exactly how that would work. We could figure it out. But that is my only caution with the third one. I do think I would say wait until January to see where the funding conversation is and then make the decision, just because, we're not behind if in January we're trying to figure out, what can Open do in terms of policy for the year. And this is just a personal opinion, I think if funding doesn't come through, then I don't think any of these options are good. And I think we need to like rethink and, decide what makes sense. Like, can we call on people to do like, small sessions throughout the year on policy issues or things of interest, or getting people together on a certain issue to talk about, things they've implemented or done, and just be thinking about it differently. Because I think, like Sarah said, Hill visits and relationships with offices are so important. And so, we don't want to look a mess as a field and be carrying ourselves in, not the best light. So that's all that I'll say with that.
I think those are really great points, and definitely an opportunity to, if the funding doesn't come through for 1 and 2, I think definitely an opportunity to upgrade the bullet number 3 for sure. So that's a good point. We don't want to make it worse. Like I'm gonna be like, man, those oral health people are kooks.
And I agree with Bianca, and I think January is actually the earliest that we really should be thinking about what the 2023 focus should be, because I think we'll know what the midterms are, but we'll need to see how the offices and how our leadership flushes out if there's changes. So I think that the timing is fine to wait until January, see what kind of funding there is, and also then really develop what can the priorities be depending on what the environment really looks like. And Georgia will take well into January to finally decide on who the senator is going to be, which is key. So
True. Okay, well, we'll close discussion on this piece down. Just wanted to let everybody know that we have been taking this charge to figure this piece out seriously. We did rule out one option, regardless of what happens with funding in the winter, and I think have some viable options that definitely need massaging, to Bianca's point. I think we can be in good shape. All right, so can I call on Bailey to tell us all of the great things that are happening at Families right now? Because I know you've got a lot going on. And then also I know there were some updates that you all were hoping to share.
Sorry, I turned on my my video and forgot to turn on my mic. Hello. Yeah, happy to give an update. We had a big launch last week that I can send around some more of the specific information about it if folks are interested, around whole person care, which is really an opportunity to be able to make sure that when we're discussing health coverage, it's not just about access to care, but it's like being thoughtful about once someone is involved in healthcare, like how do we actually make sure that we're maximizing all aspects of that to get them what they need to improve their health. And a lot of it centered on how much essentially healthcare values, like how much money we're spending into the healthcare space and making sure that that is translates into the actual quality of care that people are getting. You know, I think that really manifests in a lot of ways. I'm trying to think through some specific tie-ins to the oral health work. I mean, I think the whole person care is really integrated with the oral health work in regards to we can't continue to treat various aspects of healthcare like these like disparate, separate pieces as if oral health care doesn't impact the rest of your health. So while our oral health work is still a little bit more integrated in other aspects of families, it's, I think, a way that we are looking to reframe the way we're talking about healthcare in ways that I think is really relevant to oral health and to a lot of the folks who engage in this work. I'm trying to think through if there was anything specific that Melissa had flagged that would be good to raise with this group, but I think that was the gist of it. I can send around, we had like a press release about it and we've started releasing some papers, some of which are very specific topic areas that don't necessarily integrate specifically with oral health, but have to do with hospital consolidation and fee-for-service models and things along those lines, which don't, you know, at times not have relation to this work, but maybe aren't expressly connected. So I think those are the major things having to do with that. So it's very exciting. I mean, it is essentially just a way of us trying to reframe a lot of the work I know so many folks in this space are already engaging in, and for us to find a new way to kind of talk about the issue. Because I can personally say when I came to families and they were talking about value in healthcare, I was like, I have no idea what that means. So being able to talk about it as whole person care and making sure that we're actually providing, not only getting folks access to the care that they need for that, but then like being thoughtful about actually achieving health for people. So that's the gist. Sorry, that was a pretty quick run through. I don't know if folks have any questions specifically.
Mike looks like he's about to say something.
I would just add, since Families USA is so involved, that the CMS rule is probably going to come out within the next day or so. We're waiting for that. We have a meeting on Monday at 2 with the White House Domestic Policy Council to talk about things. So it'll either be to talk about what the rule is if it comes out beforehand, or it'll be, you know, this is what we're still advocating for the rule. So I think that that's a real win, real success, and lots of members of Open were pivotal in making that happen. So I think everyone should congratulate
Thank you for raising. I was going to pivot to that. I was going to say, so.
Oh, sorry.
No.
I'll just take over your report for you.
No, please listen. We don't have a monopoly. No pun intended on discussing issues. It's a Friday. It's a casual.
I'll say we don't have a Bailey on
that. Something about a bailiwick. I don't know. Anyway. Yeah. I was gonna say, I don't have anything to add to that. I think we know that the rule is going to be coming out soon. There are rumors that it could come out as early as today. We'll see. I think if we don't hear anything by 5 p.m., it probably isn't coming out today. But otherwise we can anticipate it in the next coming weeks. So I'm sure that there'll be interest for folks. You know, I think folks who did comment, if the rule comes out and is as we anticipate it to be, which is in line with the proposed rule, I think it's always good for folks to just take the opportunity to thank the administration for the work that they did, for continuing to, you know, keep it a strong rule. And I think we'll be in touch potentially with other talking points or opportunities to weigh in further. So, and as Mike said, there's a meeting on Monday with some folks in the Domestic Policy Council at the White House just to reinforce our support for the proposed rule and just make sure that folks who I think were less enthusiastic aren't having too much of a say in how but that the White House is making sure that they know that there are a lot of groups who are strongly supportive, and the groups that were maybe not as strongly supportive aren't having an outsized impact on what gets finalized.
That's terrific. That's really exciting.
Yeah, I mean, and seriously, I have been in the oral health space for a significantly less amount of time than so many of you. And I just think, like, it's just incredible. I mean, there's just been a lot of, this is a really important win. And I know a lot of people have been working for many decades to get there. And it's a really important step for the White House to be prioritizing it, specifically in the way that they packaged it. I think like really goes to show that they're trying to be extremely thoughtful in how do we look at aspects of healthcare and oral healthcare as not separate from the rest of the care that we give. And I just, it's a really important win. So assuming we get there, not to count our regulatory chickens before they hatch.
Yes. Well, that is great. Look forward to seeing that announcement and sharing that announcement widely with all of the network and all the people. I know Melissa also suggested a kind of a cohort of sign-on letters that are open and available right now. I think probably the easiest thing to do, particularly since this is a relatively small group, is I'll cut and paste those into the minutes and we can just share them out afterwards and maybe get them put onto the open listserv as well if people are interested in signing on. Does that work for folks? Kind of
Yes,
cruising
Sarah,
today.
if you want to send all that to me too, I can distribute that with the call recording from today.
Okay, perfect. I will do it. I think you were actually on the email,
Okay, I'll look there.
but I can also re-forward it. So we wanted to take some time to do some report outs as well from our kind of fellow sister, brother, and non-binary friends, groups that are related to us. It doesn't look like we've got a lot of representation from that, but Annalise, do you want to talk about the other NRT that you're involved with?
Sure.
And also you wanted to do an AIDPH update as well.
Did I?
Yeah, because you wanted to talk about your awesome week.
Oh, that's right. I did link it. Yes. I'm sorry. That was actually the first bullet point. So, so I don't see anybody from the rural NRT here, and I am going to informally represent them, even though I'm not a leader, I'm an active member. And I will just signal for folks that there's a roundtable coming up November 15th. I don't think it's a registration. I think it's just a Zoom link to join the meeting. So I'll add the date, the time. I think it's 12 Central, 1 Eastern. It's on technology and advancing kind of like technology and policy together for rural areas and rural oral health. So just encouraging folks, if you're interested, to come and join that roundtable discussion. When it comes to the LGBTQIA+ NRT, AIDPH wrapped up in collaboration with many of you and your organizations, LGBTQIA+ Oral Health Week, which was last week. So we were really excited with the amount of visibility and amplification that occurred as a result of that week. We curated all of the resources on our website. So there are a couple of calls to action there around policy. There's also a pledge that you can take to commit to LGBTQIA oral health equity. So we really just want to encourage folks to look through that. You can sign the pledge as an individual or as an organization. And actually, there were a lot of great resources that we curated and hope to really start promoting throughout the end of the year too, because lots of folks just added stuff to that week. It was great. One success that I saw recently, I think there might be more, but I just couldn't curate all of them. West Virginia shot down a bill. I guess I don't think it made it past committee, sort of banning the ability to change birth certificates for transgender people. That was a success because in a very red state, they just didn't move that bill forward. So that was great. The Arkansas trial, I think stopped hearing testimony on Friday last week, I want to say. For those of you who may not be familiar, Arkansas is currently going through federal appeals process and I forget which circuit they're in. I don't know if they're in the 5th. I can Google that if people really want to know. But Arkansas last year passed a bill banning gender affirming care for youth. The ACLU sued And right now it's in the Federal Circuit of Appeals, and they stopped hearing that last week. It's an important piece of legislation and an important piece of litigation, because the ability to have that go all the way up to SCOTUS for a ruling and then set precedents for the entire nation is very high. And so this really has implications nationally about what may happen when it comes to accessing gender affirming care for transgender youth in particular, but probably transgender people broadly. So that trial is going to resume in November, where I believe there'll be a ruling. I'll keep folks posted about that. As of about 20 minutes ago, Florida Medical Board voted to make gender affirming care, the practice of gender affirming care, illegal in the state of Florida, such that if a medical provider provides gender affirming care to a transgender youth, I'm not sure if it's to transgender adults too, but to transgender youth, they will lose their license. So that was voted on by the medical board just now. I assume there'll be litigation around that. There may not be much that can be done. But essentially that medically detransitions all trans youth in Florida. So that's incredibly heartbreaking and sad. And I bring that up because these are tactics when they win in one state, they go to other states. So just kind of be aware that that is happening, and it's probably going to be tried in other states too. And then I just added a map here. I've talked about it in several other meetings when people say, well, what's the call to action? It's really on the state level. There's really not a federal kind of national call to action. So this is a map that's put together by an activist that I follow, Erin Reed, and she's been updating this as sort of like bills come along in terms of like where safety is. So if you're in the red, that means bad things are happening in your state. And the call to action is for you to connect with equality organizations in your state. So it's usually Equality something, like Equality Texas is what we have here in Texas, which is one of the red states. You can also connect with HRC in your state, the Human Rights Campaign. They usually have state-based and sometimes even community-based chapters too. So that is my update, and I'm not sure if there are any other updates from NRTs, but I can also answer questions since we have some time if anybody's interested.
Can you share that, Annalise? Like, can you put that document in the chat or email it to everyone?
I just want to reflect back how just heartbreaking and horrible, and thank you for sharing that with us. And I don't even know what else to say, but it's gut-wrenching.
Yeah, and I guess to pivot to a slightly positive note, I think, Annalise, the work that you all did, sharing the resources and getting the word out, I know that the Catalyst got a lot out of it, and so I can imagine if Catalyst got a lot out of it, we're not alone. And I think it really did help to amplify some of the some ways that you can get involved that are like tactical and meaningful and not just like spouting off opinion, but truly actionable. So I think you guys did a great job with that. So I hope you feel good about that piece in the wake of a bunch of not great news.
Yeah, thanks for bringing that up, Sarah. I want to remind folks too, like even though the policy landscape around this is intensely negative, by and large, the community, like the actual people who live in these places are pretty positive and supportive. I mean, like even when you have really bad actors at the top, it's not necessarily reflective of a community of people. And so I'm really celebrating, like you said, Sarah, how a lot of people felt a lot of engagement around the topic. And I just want to thank the oral health community for recognizing that this is important and that we all have a place in making everybody feel included and valid in their lived experience.
Well, that concludes everything on our formal agenda. Does anyone have any updates to share from their particular sphere of influence or perspective? Hey, well, I'll make sure Stacy's got the links for the sign-on stuff. Thanks everyone for their time and for their discussion. What about Kentucky?
They expanded their dental benefit. The governor passed it.
They did what? I cannot hear you.
Expanded their dental benefit.
Oh, that's great.
Nobody knew it was coming, and then like a week ago, the governor just signed it.
Huh. Well, look at that.
And according to Stacey A., who's the most citable person I know on Medicaid adult dental benefits, she was surprised at how much of a coverage increase there was.
That's great. That's terrific news. Anybody else have some more great news?
I think that just goes to the, it all comes back around, because I think definitely what's happening, Annalise, now is way on the wrong side of history. And it was the same thing in Kentucky a while ago, and now they have a new governor and a new sense of what Kentucky means, and it will happen with LGBTQ rights as well. But have to go through these bad times. It is gut-wrenching.
Yeah, and Mike, thanks for bringing up a topic I'm sure everybody knows, just the midterms. So number one, if you haven't voted yet, go vote. That's critical. Please do that. And also, we are combining the November and December meetings to meet December 2nd.
Oh, right. Thanks, Annalise.
We're going to be discussing the midterm elections. So all of the states that are proposing bad things across the board, like Mike just said, we have the ability to change that. And hopefully we'll see some change in the midterm elections toward more equitable leadership. But we will also use this space in a combined meeting December and November meetings to talk about midterm implications.
All right. If that is all, we will see you guys on December 2nd. But probably also in other meetings before December 2nd.
Right, so I want to flag, we canceled the November meeting because it's Thanksgiving week, and we canceled the December meeting because it's Christmas week, and we just made it one meeting on December 2nd. So everyone should have received those calendar updates.
It'll be a festive meeting.
No doubt. Thanks, everyone.
Thank you.
Bye.
Thank you so much.
Bye.